Alright, so today we're going to be going through a typical systems review that you would do when you're taking a patient in meeting them for the first time. And you're just basically, you get them consent to do the systems review, and then you just go through the many systems of the body just to make sure that they're fit for therapy. So first, if I can have you move your arm, or put your arm right here, I'm going to take blood pressure. So we're just going to take some of the vitals, some of Aaron's vitals. Aaron, here's our patient. Alright, so he had a good blood pressure of 110/76. It's really good. And now I'm going to take his heart rate. And of course, in order to be more accurate, you could take it for the full minute. The lesser amount of seconds that you count would be less accurate, but for the video's sake, we're just going to take it for a couple seconds and do the math. Okay, so 15 seconds. Alright, so Aaron is having approximately 64 beats per minute. So if I can have you turn this way a little bit. Thank you. I'm going to check his respiratory rate. So same thing goes for the accuracy of this. We're going to take it, in this case, 15 seconds. Breathe normally, please. Alright, so he's breathing at about 20 breaths per minute. Okay, so now if I can have you, I'm just going to check his the skin turgor. I'm looking for just examining his skin, giving a quick brief look at it, see if his turgor is good, see if he has any cuts, any scars, any marks. Do you have any swelling maybe? If you did have swelling, you check for edema, you check for other issues, but in this case he doesn't. So if I can have you stand up, we're going to check our range of motion and strength. And as he's walking, I'm examining his gait, his walking patterns, and just typical things that they don't know you're checking, but you're checking at the same time as you're just having them do everyday tasks, such as walking. So if I could have you sit down and lay down, please. Alright, so now that I have him laying down on the table, I'm going to check his range of motion and strength throughout his body. Let's start with the upper body though. So Aaron, if I could have you raise your hands above your head, all the way from the side, all the way up, all the way down. If I could have you raise them forward, all the way up, and then stop halfway. Okay, so I'm going to check your strength now, so don't let me move your arms. Okay, don't let me push you down. Don't let me pick you back up. There we go. Good job. Now if you could bend your elbows right there. Don't let me push your arms down. Don't let me push them back up. Good job. Okay, now in this position, if you can rotate your hands down, hands up. There we go. Okay, now back to the middle. Don't let me rotate it upward. Don't let me rotate it downward. Okay, other side. Don't let me rotate it upward. Don't let me rotate it downward. Okay. So now, if you can hug yourself like this, there you go. Now open back up. Hug yourself the other way. Now stop halfway like this. Okay, so don't let me push you in. Don't let me push you. Don't let me pull you out. Okay. So now hands to the side. If you can bend your elbows all the way up, all the way down again. Okay, so now halfway, come halfway. So don't let me pull you down. Get my hand right here. Don't let me pull you down. Don't let me push you up. Okay. Same thing for the other one. Don't let me push you up. Don't let me pull you down. There we go. All right. And for the hands, okay, so this time for the wrists, first turn your hands over and under like this, up and down, okay, and then in your flex or bend your wrist this way, inward, and turn them over, bend them downward. Okay, so bend them down and turn them around. Don't let me pull you down. And turn it the other way, push it up. Don't let me push you around. Okay, same thing for this hand. Don't let me push you down. Don't let me push you down again. Perfect. Good job. Okay, so now, so with hands like this, push your hands outward, push them inward. Okay, so I'm going to check. So push them in, push this one in. Don't let me pull it out. Same thing this way. Don't let me push it in. Good job. Same thing. Don't let me push it outward. And push it out now. Don't let me pull it in. Okay, good job. Okay, so now you want to extend your hands all the way. Okay, now close them together. Push your thumb across. Okay, now open them up again. Don't let me pinch your fingers together. Okay, don't let me pinch these fingers together. Now push your thumb this way. Okay, don't let me pinch it together. There you go. Okay, and same thing for this thumb. Pinch it together. Okay, so now with your hands open again, stick my fingers in between you. Try not to let me pull my fingers out. Okay, now squeeze my hands, or squeeze my fingers as tight as you can. Good job. Grip strength. And that's pretty much, with the exception of this one. Don't let me turn your hand over. Don't let me turn your hand down. Perfect. Okay, so don't let me turn your hand over. Don't let me turn it downward. Perfect. Alright, and that should be typically your full upper body range of motion and strength test that you'd want to run. Alright, so after you take care of the upper body range of motion and strength, we're going to move on obviously to the lower body range of motion and strength. So first we're going to start with the hip. So if I could have you I'll check your extensor range of motion. So let's bend your knees right here, and just lift your hips up off the table. There you go. Perfect. Okay. So now straighten your legs back out. So bend your knee up to your chest as high as you can. There you go. Back down. The other knee up to your chest. There you go. Okay. Now bend this one. Same thing, halfway. Okay. So now don't let me move you. Okay. So don't let me push it upward. Perfect. Don't let me push you down. Perfect. Okay. Now push. I'm going to support you here, but don't or just push it inward. Push your foot inward. There you go. Rotate this way outward. Okay. So don't let me push you in. Now push it back in. Don't let me pull you out. Perfect. Okay. Straighten this one out. We'll do the same on this one. Okay. So I'm going to support you, or still let me test you upward. So I'm going to push you down, so push you up, so don't let me push it higher. Push this way. There you go. Now don't let me push you downward. Perfect. Okay. So now bring your leg towards me. Okay, now push it outward. Okay, so don't let me bring you in. Don't bring it back in. Don't let me bring you back or push you out. Perfect. Okay, straight legs. Now bring your leg out towards me. There you go. And back to the middle. Cross the other leg. And back down. Same thing for this one. Push it outward. I'll bring it back across the other leg. Here we go. Okay, so don't let me squeeze your thighs together. Perfect. Don't let me open them. Okay. Check your knee. So bend your knee as high as you can. There you go. Perfect. Okay. So now straighten it up, or right here. So don't let me push your knee downward. There we go. And now bend it a little more. Don't let me pull it up. There we go. Same thing for this one. Don't let me pull your knee upward. Don't let me bring it up a little bit. Don't let me push it downward. Go. Perfect. Okay. So now the ankle, straighten your leg. Can you do some ankle pumps up and down? Perfect. So push them down. Don't let me bring it up. Okay, so let me bring it up. Okay, now bring them towards you. Don't let me push them down. Don't let me push them down. Perfect. Now, without twisting your leg, just bring your feet towards the middle. There you go. Now push them outward. So don't let me push them in. Don't let me push them in. Okay. Now bring them in again. Don't let me push them out. Don't let me push them out. Okay. Now, last one, your toes. So wiggle your toes forward and back. There you go. Okay, so keep them up towards you. There you go. Don't let me bring them down. Don't let me bring them down. Now push them down as far as you can. Don't let me push them up. Then push them up. Now the last one, separate your big toe from the other toes. So you want to basically go like this with your toes. Separate them. There you go. Okay, now don't let me push it down. Don't let me push it down. All right. And that's typically the end of the system review. But as I was doing it, I was also the communication part. He's listening to the commands that I'm giving him, and he's performing everything I'm asking. So that's all showing that he's understanding, he's listening, and he's taking that. We're taking that into consideration without him even knowing that we're doing it. So, thank you, and that's about it.